Hello, my name is Keegan McTarian, and I will be presenting my major course project. As of spring 2021, Indiana State University does not have a maternity nursing course included in the curriculum for the LPN to BSN online program. The major course project that I'm developing is to add a maternity course to this program. It is estimated by the World Health Organization that over 800 women die each day from treatable complications from pregnancy, and most of those deaths are from low socioeconomic situations. Another shocking fact is that approximately 9% of all deliveries in the United States result in an adverse obstetric event. The purpose of this project is to add a maternity nursing course to the current LPN to BSN program curriculum. This course would be named Maternal Newborn Nursing. The reason for this program change is that educational programs should address adverse obstetric events by creating awareness through evidence-based education to healthcare professionals. Future registered nurses need to have a basic knowledge of maternal and infant nursing care, regardless of their practice location, as these patients can present in many settings. Educating nurses about this specialty could reduce maternal mortality and improve patient outcomes. The educational philosophy for this course includes social learning theory, experiential learning, clinical experience, and formative as well as summative evaluation. Social learning theory activities through discussion board responses to peers will be used in this course. Students learn from one another in their discussion board postings as well as interact through these postings. Experiential learning activities are utilized in both discussion board postings and clinical notes. Students will practice how to write nursing notes on maternal newborn patients through the clinical notes. Discussion board posts will create critical thinking of students in patient situations. Clinical experience activities are an important aspect of the course. These experiences will take place with a preceptor in a clinical setting. Formative and summative evaluation will take place in the quizzes, midterm exam, and final exam. The students for this course will be junior level nursing students in the LPN to BSN online program. These students will have some nursing experience as an LPN, and some may even have maternal newborn patient care experience. It will be considered that these students have successfully completed pharmacology, pathophysiology, health assessment, and 2 adult clinical courses prior to starting this course. Because this course is a specialty, it will be after 2 adult clinical courses so that students can build their knowledge from those courses. The plan of study will have to change to accommodate this new course. It could be added to the Nursing Care of Adults 3 course, which is currently a 5 credit hour and 90 clinic hours in the program. It is possible to create an 8-week course of Nursing Care of Adults 3 for 4 credit hours with 60 clinical hours, and then add the Maternal Newborn Nursing course as an 8-week course for 3 credit hours and 45 clinical hours. This would take away some of the clinical hours in the adult course, but students would be utilizing other clinical skills in the maternity newborn course. The total change of credit hours will be 2 credit hours added to the 5th semester in the program, which would total 16 hours. At the end of this course, students will be able to develop assessment skills of pregnant, unborn, postpartum, and newborn patients. They should be able to demonstrate understanding of basic nursing care for the pregnant, unborn, postpartum, and newborn patients. Students will identify and demonstrate understanding of the female, newborn, unborn patient anatomy and physiology as it relates to this course. And students will utilize critical thinking skills to identify needs of pregnant, unborn, and newborn patients, as well as identify possible complications or risks for these patients. There will be a variety of evaluation methods used in this course. These include online Blackboard quizzes, midterm and final examinations, discussion board assignments, and clinical notes. Students will have different opportunities throughout the course to show their knowledge and growth with these evaluation methods. This course will be broken down into theory and clinical assignments. In theory, there will be 8 quizzes that will be worth 25 points each. The midterm exam is worth 150 points, and the final exam is worth 150 points. Discussion boards will be worth 50 points each, and there will be 6 total discussion board assignments. In clinical assignments, there are 8 total clinical notes worth 25 points each. The total points for this course is 1,000. There will also be some clinical assignments that will be pass-fail. That includes the Clinical Rules Agreement, Student Clinical Information Survey Form, Preceptor Agreement Form, Evaluation of Student by Preceptor, Evaluation of Preceptor by Student, and the Clinical Hours Log. Here is an outline of the major course project timeline. This Gantt chart shows the proposed completion of this course edition. From March 25th to May 24th, Keegan-McTerrian will complete the proposal of the course edition. Between May 25th and May 31st, Keegan and Candace DeCorvell will present the proposal of the course to the curriculum committee. If the curriculum committee agrees to the addition, Candace will prepare and present the course to the Executive Director of Nursing and the Dean of Indiana State University. This will be completed between June 1st and June 7th. If the change is approved, the Executive Director of Nursing will notify Indiana State Board of Nursing and ASIN of the course change between June 8th and June 14th. From June 15th to August 14th, the LPN to BSN faculty members will work to implement the new course and prepare for the fall semester, which would be the first time this course is offered. It is my recommendation that Indiana State University add a newborn course to their LPN to BSN program. The hope of this proposal is to show Indiana State University how they can add this course to their current program plan without much disruption in their program. It was also a priority to ensure that the students would be able to handle the additional load of clinical hours and course hours in that semester. These are the references that were used for this PowerPoint presentation, and that concludes my presentation. Thank you very much.